Okay, we're going to do some exercises for hip pain. If you can maintain internal rotation of your hips and hamstrings that are flexible, then you're much less likely to have back pain. That's what the studies show. So we're going to do some exercises that are based mainly on internal rotation of the hips and flexibility in the hamstrings, but we'll do both. Okay, so if you want to jump in and just join me, let's go right foot forward, left foot back, and a little bit longer than a walking stride. So you're going to grab the floor with your feet, kind of that allows your arch to kind of pull up. You're going to, your heel on your left foot is up off the ground about an inch. Both knees are unlocked. You're going to scissor your legs. So your right hamstring is engaged, your left quad is engaged. You're scissoring. It's a pretty strong stance. As you do that, you're going to feel yourself get a little bit taller. Okay, your weight is 50-50 right here. You're scissored, and we're going to just spend a minute and we're going to breathe into the back of our ribs. So a popular thing is yoga breathing. I'm not a super fan because we don't need hypermobile stomachs. Our stomachs are pretty mobile. We also don't want to breathe into our chest as well. I get that's the point. But where I want you to breathe is into the back of your ribs. Your intercostal muscles are breathing muscles, and you want some flexibility there. So as you are breathing, think of filling your chest cavity. Think of spreading your ribs apart. While you do it, you're going to keep your shoulders pulled down because they're actually not attached structurally to your rib cage. So you're going to keep your shoulders down as you really inflate your rib cage, especially into the back of your ribs. You want to think of expanding and finding more space between your ribs. So as you do that, you're still scissoring your legs. That can be just quite tiring right here. Okay, after taking some deep breaths, we're going to slowly transfer weight into the right foot. So 60-40, 70-30, and you're going to, so most of your weight is on the front, your heel's still off the floor. You're going to slowly rotate your left hip into the right. So your knee is stable. You're really using your feet and your shin to make sure that knee is pretty stable. It's not turning out. Your foot is centered. So you're going to rotate that left hip into the right one, really grabbing the ground with your foot, and you're going to feel your TFL, your glute med, do a little bit of work here. Just back and forth. You're going to feel that stretch. And then we're going to add another element to that. You're going to come down, really feel your hamstrings engage, come back up, and then add a rotation. And then center. Come back down, feel your hamstrings. Come back up halfway, and then rotate to the right. And then back to center. Go down into your hamstrings. Your front knee is still unlocked. And then rotate to the right. So after you've done that about 5 or 8 times, you'll feel that right hip fatigue and your hamstrings as well. But we're working on that internal rotation and flexibility in our hamstrings. And then come back up and switch sides. Should I switch sides?
You want to?
How do you, yeah?
Yeah.
That's right. Okay. So again, We are 50-50 weight. We're gonna scissor for just a second. We're grabbing the ground with our feet. Our knees are unlocked. 50-50, we're gonna scissor. Feel the hamstring of the left leg and the quad of the right. Feel that scissor. Feel the attachments into the pelvis. Feel how the muscle runs from the knee up to the pelvis. And then just take a couple deep breaths, inflating your rib cage, shoulders down, back of the neck long. When you've had a couple of deep breaths, then we're going to transfer weight into the left leg. Both knees are unlocked. Joints of the feet are grabbing the floor. And we're going to rotate the right hip into the left. Feel all of those muscles get long. Then we're going to come down, engage the hamstring of that left leg, come back halfway, and rotate. This is all at the hip. The rib cage is not following. Well, it's going along for the ride, but it is not, the motion is not coming from the upper body. It's all in the hips. Come back down, tighten up the hamstring, halfway. Come back up. We're pivoting from the hips, maintaining all of our curves in our spine. Halfway up, rotate into the left hip. Back down. Halfway up, rotate into the left hip. And then come back, come up and shake that off. Okay, so now we've worked on flexibility in our hamstrings, and we've worked on internal rotation of the hips. So we're going to come down to the floor into a 90-90 position, and you're going to sit up straight. So if you have a mirror to look into, or just pay attention, you don't want to be here, you want to be sitting up tall. And you want to slowly be able to work that front knee into the ground. So as you do, you can come forward and actively press all of the lateral side of that front leg into the ground. And you're going to hold it. Remember, you can't stretch a muscle in 15 seconds. This takes time. You're going to spend some time here. While you're doing it, you can do 15 seconds. Press for 15 seconds and then release. But you're going to be actively working at this for a couple of minutes. That's about how long it takes to really stretch a muscle. You're going to find that one side is going to be tighter than the other. So spend some time on that tight side. Okay, and then as you come back up, you can, for a while, you may have to pick that back leg up, but as you work on internal rotation of the hips, you can pick that up, engaging the TFL, a little bit of glute med into your IT band. And then you're going to come down and leave your feet where they are. Open up the right, or whichever one was in back. And now you're on the other side. So this side might be tighter, it might be looser. Either way, you're going to work that front knee into the ground, focusing on sitting up straight, picking yourself up and coming forward from the hips. We're not flexing the back. We are going to maintain that lumbar curve. We're going to pull from the hips to come forward. Spending the time that you need, which is not 15 seconds, it's going to be closer to 2 minutes, to stretch out that lateral side, working on that rotation of the hip. Then you're going to pick up the back one. If you need some help for a while, working on that rotation of the back leg. And then you can go back and forth, just keeping those hips moving, rotating. There's not a lot of, in the hip joint, there's not a lot of space. It's actually a pretty tight fit. There is synovial fluid in that, but it's very like a layer like you would put a moisturizer on. It's very light. So the only thing that bathes that joint in that fluid, which keeps it healthy, is movement. So analyze what you're doing throughout the day. Are you moving your hips through full range of motion so that they get bathed in that fluid so that they can stay healthy? So we don't want to just use a piece of our range of motion. We want to use all of the range of motion.